We are so excited to have Maren Scott and Marcy Reed with us from Legacy Cancer Institute. They are both oncology certified dietitians. And I think we all can relate to hearing a lot of information around food and breast cancer. And we sometimes don't know what to believe and what not to believe. So we're really happy to have some experts here today to help give a little clarification to that for us. Um, so I'm just going to say one last time to please put your name in the chat for us if you can. And with that, I'm going to turn it over to Marcy and Maren. Thank you so much for being here.
All right, thank you. Thank you, Amy, and thank you everyone for coming today. I'm going to be starting out and as Marcy. I'm going to share my screen here. Let's see. Okay, and let me know if there's any issues with seeing the PowerPoint. But again, today we're going to be talking about busting myths around breast cancer and food. And so much information out there in the media. So we picked some of the top hot topics today. And then we're going to be also talking about cancer fighting nutrition and some other topics. So again, thank you so much. And let's just get started here. So let's see. Okay, so starting out, I thought I would start this out by talking about some of the terms I'm going to be discussing today, just to make things a little bit more clear as we go through the presentation. So first of all, a phytonutrient is basically another term for this is phytochemical. They're nutrients that are found in plant-based foods that have health benefits to humans. Um, a phytonutrient is not found in animal-based foods, so not found in meat or dairy, but predominantly in vegetables, fruits, legumes, nuts, and seeds. And there's been hundreds of these that have been identified. Next is a free radical. So a free radical is an unstable molecule that can cause damage to the body. This is a very normal metabolic process in humans, or it can also come from external sources such as smoking or air pollutants. And then an oxidation just refers to damage that can occur in the body as a result of free radicals. Again, a normal process in the body. It's kind of the body's way to help fight against pathogens. Antioxidants are molecules that can stabilize free radicals. I like to think of them as molecules that kind of help protect our cells from damage and disease. A carcinogen is any compound or substance that can contribute to cancer development. There's a lot of these that have been identified out there. Some that you know of already are asbestos, just to give examples, processed meats or blackened meats. And then also inflammation is the last one, which can be acute or chronic. We know that chronic can lead to damage over time to cells or blood vessel walls, and in turn, this damage can play a role in cancer development. So moving on, let's look at myth number one. So the first one we wanted to discuss is soy will increase my breast cancer risk. So we do know there's been a lot of confusion over the past 10, 15, 20 years around soy, especially with the hormone-dependent cancers. This confusion about the health effects of soy arises from the term phytoestrogen. And so some soy nutrients, specifically what are called isoflavones, may have heard that term, have chemical structures that look like estrogen found in a woman's body. And this is where the term phytoestrogen came from. However, phytoestrogens are not the same thing as female estrogens. And we also know that soy foods do not contain estrogen. So it's very encouraging that there's numerous studies showing that women who regularly eat soy foods have a lower risk of breast cancer and breast cancer recurrence. It's also true, this is true for both Asian and American women, and for women who ate soy foods early in life, and also for women who added them into their diet as adults. When we look at the research on this topic, there's one research review considered a total of 131 articles, so including 40 randomized controlled trials, 11 uncontrolled trials, and 80 observational studies. The study supports soy safety for women with a history of breast cancer, definitely noting that soy consumption may be associated with a reduced risk of breast cancer incidence, recurrence, and mortality, and that soy does not have an estrogenic effect in humans. So they also did a large pooled analysis of breast cancer survivors in the United States and Asia, and found that moderate soy food consumption was associated with a decreased recurrence. Excuse me. Furthermore, these studies do not show any harmful interactions with tamoxifen. So for those of us that take tamoxifen with a cancer diagnosis. So people ask me, what is moderate consumption? That is defined as 1 to 2 standard servings daily of whole soy foods, such as tofu, soy milk, edamame, miso, etc. They've also found that up to 3 servings a day of soy have been consumed in Asian populations long term without a link to increased breast cancer risk. So we know that a serving of soy, just for your reference, is about 3 ounces or a third cup of tofu, a cup of soy milk, half a cup of edamame, a tablespoon of miso, or 3 ounces of tempeh. So if you would like to eat soy foods, it appears that this is very safe and potentially beneficial. Beneficial being that there's fiber, protein, antioxidants, calcium and iron, and a lot of other phytochemicals, phytonutrients in soy products, in whole soy products. So, however, if you don't enjoy soy foods, this doesn't mean you have to start eating them. You can get a lot of these things from other plant-based foods. And then at this time, there isn't enough information about soy supplements, such as concentrated isoflavones, to know if they are safe. So the main message here around soy and breast cancer risk is that overall, we encourage you to enjoy whole soy foods, meaning tofu, tempeh, miso, edamame, and to avoid refined soy products, which would be, when you think about like protein powders, pills, protein bars, some of the meat alternatives that are made out of soy. They're very refined, and the isoflavone content, it's kind of a gray area. So we just steer clear of those. All right. And we're going to have some time at the end for questions, by the way. I'm not sure if that was mentioned, but. So myth number 2, a glass of red wine a day is good for my health. So when it comes to breast cancer and several other cancers, the answer is no. Research shows that even a small amounts of alcohol on a regular basis increase the risk of breast cancer, and that we also know that this risk increases with higher amounts of alcohol. So I have folks come to me and say, well, Marcy, what about all the antioxidants in red wine? Aren't they good for us? Well, so there's resveratrol, which is a phytochemical in red wine. And they've done lab studies on this, which has linked the resveratrol with anti-carcinogenic effects. So that's fantastic. However, they've also done research in humans that doesn't support that red wine is different from other alcoholic beverages in relationship to cancer risk. So in other words, they treat red wine in human studies exactly like they would treat all other types of alcohol. It's possible that small amounts of alcohol may play a role in heart health, but this research is ongoing and by the American Heart Association. And they caution that if you don't drink, probably not a good idea to start. And for those women that do drink, the American Heart Association recommends to limit your intake to no more than a drink a day. There is strong evidence that drinking, so keep this in mind, that drinking any type of alcohol is a risk factor for cancers of the mouth, the pharynx, larynx, esophagus, liver, stomach, colorectal, and breast, both pre and postmenopausal. So some people want to know kind of the mechanism behind why alcohol actually puts us at a higher cancer risk. And according to the Academy of Nutrition and Dietetics, um, there's several mechanisms that can act in the body. The first one we know is that ethanol, which is a product of alcohol, is classified as a human carcinogen. We also know that alcohol metabolism generates reactive oxygen that can damage our DNA. And then lastly, we know that alcohol may increase circulating levels of estrogen. So any amount of alcohol we drink increases estrogen in our bodies, which is an established risk factor for breast cancer. So our main message here is that if your main goal is cancer prevention, it's best to not drink alcohol or really practice moderation. All right. So myth number 3, sugar fuels breast cancer growth. And I get this question almost weekly from folks. Does sugar feed cancer? So very common. You'll see it in the media and on the internet, but we know that there's no direct link between sugar and cancer. And this is because all cells in our body need sugar or glucose to live. And there's also no clear evidence that the sugar in your diet preferentially feeds cancer cells over other cells. So to kind of put this into perspective, we eat carbohydrates such as, there's so many different types, but say, let's just throw out rice and pasta and bread. It could also be like a cookie or a piece of pie. They're all carbohydrates, right? And so we eat those products, or one of those products, and it turns to glucose in our body. And so glucose is circulating around, and this triggers our pancreas to make insulin. We need insulin to live. We need glucose to live. What the problem is when we eat way too many carbohydrates in one sitting, especially without any protein, we have too much glucose or blood sugar floating around in our system. That can put our body into a state of too much insulin produced by the pancreas called hyperinsulinemia. And so this is the direct link is insulin and potentially cancer cell growth. So there's a lot of research shows that sugar's relationship to higher insulin levels can influence cancer cell growth the most. And eating a lot of carbs, like I just explained, at once can raise insulin levels quickly. And that when insulin levels are high, the body increases storage of calories as fat. So we know that when we have hyperinsulinemia, that makes it hard to maintain weight and we're at risk for gaining weight. So other risk factors for elevated insulin levels include genetics, sedentary lifestyle, so not being physically active, and being overweight or obese. So my main message here is to try to choose quality carbohydrates and limit high glycemic foods. So to kind of define what those would be, quality carbs that we would want to emphasize could be just something as simple as whole wheat bread, steel cut oatmeal, all brand cereal. There's a whole ton of different whole grains, barley being one of them, just to pick one, berries, most vegetables, and beans and legumes. And that's not an inclusive list. There's a lot of different ones. And then the high glycemic foods would be to throw some out would be white bread, pretzels, corn chips, instant oatmeal would fall under there, instant potatoes, graham crackers, things that are processed and packaged. And those are the ones you'd want to limit. So moving on to the next myth number 4. Being a little overweight has no effect on my breast cancer risk. So, American Institute for Cancer Research has put out a lot of information on this. They've found that any amount of excess body fat raises risk of breast cancer to some degree. It is a risk factor, and that too much body fat is one of the strongest factors linked to increased risk for postmenopausal breast cancer. Statistically speaking, roughly 1 in 5 cases of breast cancer are due to excess body fat, and that along with breast cancer, being overweight and obese increases risk of many other different types of cancers as well. And so again, some people ask, well, what is the mechanism behind having too much body fat and my cancer risk? Well, again, this is according to the Academy of Nutrition and Dietetics, that adipose tissue, which is a fancy term for saying excess body fat, is the primary site of estrogen production in postmenopausal women. We also know that obese women tend to have higher levels of bioavailable estrogen, which is associated with postmenopausal breast cancer. Um, the next mechanism is that we know that excess body fat is linked with decreased levels of a very protective hormone called adiponectin. It protects us against cancer, and those levels are lower in people with excess body fat. And then we also know that being overweight can lead to chronic systemic inflammation, which can promote heightened cancer development. So my main message here is that maintaining a healthy body weight throughout life may be the most important lifestyle factor in reducing cancer risk, second only to not using tobacco. So with that being said, we're going to move over to Maren Scott, and she can take over for now. Thank you.
Thanks, Thanks, Marcy.
You're welcome.
So I'm going to be talking a little bit about how cancer develops and how certain foods can help your immune system be more responsive and defensive against cancer. So cancer develops as a result of many different factors from both genetic and environmental causes, with lifestyle factors also playing a large role. And age is also often a factor, since as we age, our bodies become less efficient at repairing damage done to our cells and DNA. It's been shown that on average, human DNA takes about 800 hits or attacks per hour. So that means that every single hour, there is potentially a chance for our DNA to become damaged or mutated from various environmental or internal factors. And it's up to our immune systems to repair that damage. And cancer is actually a lot more common than people realize. It's estimated that the average American will develop cancer cells in their bodies 6 times in their lifetime. And autopsy reports have shown that 40 to 50% of people who died of non-cancer related causes actually had cancer cells in their bodies at the time of death, just not at a point where it was detectable. So cancer actually takes years to develop into detectable, diagnosable tumors. And according to the American Institute of Cancer Research, 42% of cancer cases and 45% of cancer deaths are attributed to lifestyle factors such as diet, excess weight, and lack of exercise. So, although there are certain factors in cancer development that are not as much in our control, one major component to eliminating cancer growth before it can start, slowing the growth of existing cancer, and preventing reoccurrence is in eating the foods that help create an inhospitable environment for cancer cells. So what we'll be focusing on today are the foods that help do that, and many of these are plant foods. And Marcy, can you
I'm sorry, a little technical error.
oh, that's
Oh, there
okay.
we go. There it
Okay.
worked. Okay.
So foods that come from plants have been shown to have significant health effects in the body. This is due primarily to the high concentration of phytonutrients in plant foods that have a variety of health benefits in our bodies. So as Marcy already talked about, plant foods such as vegetables, fruits, grains, beans and legumes, and nuts and seeds have been shown to be protective against not just cancer, but also major chronic diseases in our country, such as diabetes and heart disease. The American Institute of Cancer Research estimates that if the only dietary change made was to increase the daily intake of fruits and vegetables to 5 servings per day, cancer rates could decline by as much as 20%. And there have been a lot of studies that have looked at the beneficial impact of cancer fighting foods on cancer cells. Eating these foods can provide protection and boost immunity right away and can even continue helping the body for hours after. So, needless to say, if you eat these on an ongoing basis, it will continue to provide health benefits. And while genetics does make certain people more predisposed to develop certain types of cancer, plant foods have been shown to actually alter the way your genes express themselves. So, meaning you can't change your genes, but what you eat can affect what your genes do and either turn on or off abnormal gene activations. So now we're going to look at the blue zones. And if anyone isn't familiar, the blue zones refers to 5 places in the world that have the largest proportion of people who live the longest, many of them over 100 years old. And so scientists have been really interested in studying the lifestyles of these people. And from a nutrition standpoint, one of the things they have in common is that in these areas of the world, they get the majority of their food from plants. And you'll see that only one of these 5 places is in the US, and that's Loma Linda, California. The others are in Greece, Japan, Costa Rica, and Italy. And the reason given for Loma Linda making the list is that it has the highest concentration of Seventh-day Adventists in the US, and they are vegetarian as part of their religious practice, which means they are likely getting more of their food from plant sources than many Americans who eat a typical American diet. Next slide. So I do want to point out, because we are talking so much about plant foods, that following a plant-based diet does not mean that meat or other animal foods needs to be eliminated entirely, but it should just be more of an accent rather than a focus of a meal. And that being said, there are some types of meats that are best to eat in smaller amounts. Red meat, as well as cured meats, like pepperoni, bacon, sausage, and deli meats, as cured meats have nitrates or nitrites that can form carcinogens in the body. And also meats cooked at high temperatures, such as barbecued meats, or cooked for long periods of time, such as smoked meats, should also be limited because these form specific compounds called heterocyclic amines that may fuel the growth of cancer and cause gene mutations. So it's been shown that cooking at temperatures above 300 degrees causes these compounds to form, and the longer they're cooked, the more that form. Okay, next. So I also want to emphasize that all plant foods provide health benefits in some form, and that's why it's important to get a variety of them in the diet. But the ones that we'll be talking about today are the ones that have been shown in research to be effective at fighting cancer. So the first group is the cruciferous vegetables. So according to the National Cancer Institute, this group of vegetables has been shown in animal studies, as well as studies done on cancer cells in a lab, that they can help protect cells from DNA damage, help inactivate carcinogens. They are antiviral and antibiotic. They fight inflammation in the body. They cause death of cancer cells, and they limit tumor blood vessel formation and the spread of cancer cells. So it can be kind of difficult to reproduce the results of these studies on humans. And that's just due to there being a variety of just differences between individual people, such as taking into account any other foods the study participants may be eating, differences in food preparation, food reporting, and specific lifestyle and environmental factors. But one study published in the Molecular Nutrition and Food Research Journal in 2022 examined the anti-cancer effect of broccoli sprout juice. And if anyone isn't familiar with broccoli sprouts, there's a picture right there on the screen. They are considered to be much more potent in the cancer-fighting compound called sulforaphane, which is a phytonutrient, than fresh broccoli. So in this study, 30 postmenopausal women with breast cancer were given either broccoli sprout juice daily for 2 weeks or a placebo. So they were given nothing, basically. At the end of the 2-week study, those given the broccoli sprout juice had better outcomes in looking at tissue level markers that looked at cancer activity compared to those given the placebo. So while more research and larger sample sizes are needed for humans, this study supported that the compounds found in cruciferous vegetables does support cancer-fighting activity. Okay, so next we're going to talk about garlic and onions. Garlic and onions are part of the allium family of vegetables. Garlic has a lot of different health benefits. It can lower blood pressure and cholesterol. It's a natural antibiotic and overall is very helpful for the immune system. According to a review of studies published in a journal called Phytotherapy Research in 2019, there are several proven ways that garlic and onions stop cancer growth. They can disrupt cell cycles. They interfere with signaling pathways that can contribute to cancer growth. They cause cell death, detoxify toxins, and provide antioxidants that specifically interfere with the formation, the growth, and the spread of cancer cells. Garlic has also been shown to stop the formation of nitrosamines. And nitrosamines are a carcinogen that forms in the body after you eat meats or other foods that are cured with nitrates, like we just talked about. And it can be difficult to determine exact amounts of these foods to eat to demonstrate these positive effects, but the American Institute for Cancer Research did a clinical trial that showed that eating 1.5 teaspoons of garlic per day activated genes that helped regulate the self-destruction of abnormal cells and immune function. Okay, next we'll talk about mushrooms. So mushrooms are becoming increasingly popular as being added to different foods and probiotic shots, and there's a good reason for that because they are very helpful for the immune system. Research has shown that specific compounds called beta-glucans that's in all mushrooms have medicinal properties in humans that, because of their benefits to the immune system, are helpful in slowing and stopping cancer growth. And the way that mushrooms work is that they actually activate your body's own immune response. So they activate your white blood cells to be more active against viruses and cancer cells and anything else that you need to fight off in order to remain healthy. And there was a clinical trial sponsored by the National Institutes of Health that gave women who had just finished radiation therapy for breast cancer a product made with turkey tail mushrooms, and the results showed that there was an increase in natural killer cells and other cancer-fighting cells in the immune system. Okay, and so next we'll look at fruits. So the fruits that are shown here have all been shown to help protect against and repair DNA damage, help reduce inflammation, and interfere with cancer start and growth through a variety of ways. Berries have been shown to help fight cancer by fighting inflammation, limiting the start of cancer cells, protecting against DNA damage, as well as slowing growth and triggering the death of cancer cells. Pomegranates have a specific phytonutrient that's been shown to be an antioxidant, anti-inflammatory, and have anti-cancer effects. A study published in the National Institute of Health National Library of Medicine showed that pomegranate juice was able to interfere with breast cancer development in a variety of ways, including reducing the enzyme that turns certain hormones into estrogen, limiting breast cancer cell start and growth, and hindering other processes that led to cancer cell promotion. Citrus fruits have been found to help rid the body of free radicals, as well as play a key role in the processes of cell survival and death. According to a study published in the Evidence-Based Complementary and Alternative Medicine Journal in 2022, citrus fruits were shown to inhibit cancer cell growth and spread while also making specific cancer drugs more sensitive in targeting cancer cells. And lastly, cherries. Cherries help fight inflammation, and they also naturally contain melatonin, which has been shown to have benefits in preventing and fighting cancer, especially breast cancer. According to a review published by the endocrine-related journal, Cancer Journal in 2015, higher melatonin levels were found to reduce estrogen receptor activity that led to estrogen-positive breast cancers and interfered with pathways leading to the growth of breast cancer. So just getting melatonin in general is helpful for cancer prevention as well, and cherries is a good way to get that. Okay, next slide. So next we're going to look at beans. Beans have fiber, antioxidants, and phytates that all work together to decrease cancer risk as well as other health risks. And because they add fiber to the diet, they're able to move things through the digestive tract more quickly, which lessens the time that toxins and other waste can sit in your body. And then good fiber intake can also help with weight management, which can also lower breast cancer risk. Okay, next. And then whole grains. Studies have shown that the more whole grains people get in their diets, the lower the risk of developing type 2 diabetes, cardiovascular disease, and certain cancers. And the fiber, as well as the specific phytonutrients in whole grains, are believed to be the reason for these benefits. But it should be noted that half of the benefit, or a lot of the benefit, is in that people who eat whole grains are eating those instead of refined grains. So it's almost more important just to not have the refined grains than to, I mean, the whole grains are healthy too, but skipping the refined grains is the best thing to do. Okay, and next. So omega-3 fats, there are 3 different types of omega-3 fats. There's ALA, which is the kind found in plant foods such as flax seeds, chia seeds, and walnuts. And then the other 2 forms are DHA and EPA, which most people get from eating fish. For people who do not eat fish, taking an algae supplement is a good way to get DHA omega-3 fats. Omega-3 fats have been shown to be important for reducing inflammation, for mental well-being and brain health, and fat and energy production. And they can also help protect against infection and may enhance the effectiveness of treatment, as well as reduce certain side effects from treatment. There was a study that was published in 2019 that looked at breast cancer patients who were experiencing joint pain as a side effect of cancer treatment. And the study found that those taking an omega-3 supplement experienced decreased pain. And in another study, those taking omega-3 fat supplements did not develop neuropathy compared to those taking a placebo. And then next one. So the last group of foods that we'll talk about is probiotics. Probiotics are live bacteria that populate the intestines. They're the result of fermentation from yeast, bacteria, and molds. And humans are estimated to have anywhere from 39 to 300 trillion bacteria in their bodies, and the majority of these are in the intestines. Of those, it's believed that there are about 300 to 500 different species of bacteria in our intestines. The ways that probiotics have shown to be helpful against cancer are by controlling cell division and growth of cancer cells, either by killing cancer cells or letting out compounds that are harmful to cancer cells and prohibiting their growth. They can reduce enzymes that allow compounds in the body to become cancerous. They help stimulate the activity of immune cells, such as T cells, B cells, and natural killer cells. And they reduce the number of harmful substances in our intestines. So overall, for a long time, people have known that probiotics are very good for digestion, but they are also very important for the immune system as well. Okay, and then next. So even if I didn't discuss a specific food here in this presentation, I do want to just emphasize again that all plant foods will have health benefits in the body. So greens such as spirulina, wheatgrass, or chlorella, nuts and seeds, spices such as turmeric, especially turmeric and the whole list, those are all very healthy for you. If it grows in the ground and is edible, it's good for you. And then as a final note, I just want to also point out that if you're not much of a cook, or you are going through treatment and you have a lot of fatigue and you don't have the energy to make all these fresh foods and vegetables, you always can find pre-made powders, juices, or smoothies at the grocery stores. There's super greens powders or superfood protein powders. There's blended fruit and vegetable drinks at the store. You can also make your own juices or smoothies at home. And for anyone who's interested, we do have a build a smoothie handout that we can provide. And then lastly, the foods discussed here are best to be eaten in whole form. But if you want to take a supplement and are currently undergoing treatment, just make sure to discuss with your doctor to make sure it's okay.
Okay. Well, thank you. That's we wanted to leave a lot of time today for questions. So that's concludes the presentation part of our of today. So Amy, I don't know if you wanted to take over for the questions.
Sure. Yeah, there's definitely some in the chat. So I'm just going to back up and start with the first one that was put in there. Let me see here. I gotta scroll through the names to find it. Give me one sec. Someone was asking about if steel cut oatmeal, when you were talking about the oatmeals, is really better than just regular oatmeal.
I
Like
kind of
maybe steel cut versus instant, maybe, or regular.
Yes. So steel cut and like whole rolled oats, I kind of view as the same as far as both being a whole grain and good for nutrition, and a lower glycemic index. It's the instant oatmeal that actually has the higher glycemic index that we want to try to minimize in the diet. Great question.
And when you were talking about maintaining a healthy body weight, someone wants to know, how do you define what a healthy body weight is?
Um, So I would just encourage you to look at do a BMI search, and it's a way to, it's not all based on BMI. There, I don't love just paying attention to numbers, so, but that is one tool that we do have is looking at height versus weight. You can just plug that in to a BMI chart and see where you fall. That's the first tool. But talk to your doctor about where you're at or your dietitian on an individual basis about where you're at, and you can have more of a discussion. But that's the first tool I would use.
Okay, and then um, another question, which was actually my question,
Okay,
I'll be
okay.
honest there. I was just curious when you were talking about the smoked meats and the nitrates, is it really the nitrates that are the big problem? Like, what if you're eating a nitrate-free whatever? Is that better, or is it just all like just try to not do it?
So the issue is that when you eat those meats, there's compounds in the meat that combine with the nitrates that forms the nitrosamines. And so when you find a nitrate-free meat, generally that means that they have cured it with celery powder, which is because nitrates are found in certain vegetables. And celery powder will still it will still combine with the products in the meat to make the nitrosamines, but it's a way for advertisers, whoever's making that product, to make it seem like it's a healthier option. An actually uncured meat, like a truly uncured meat, will often be a different color. It won't look fresh. And so there is not really a better alternative. So it's because of the whatever nitrate is used, whatever form, whether it's celery powder or the more preservative kind that's typically used, it will combine with the compound in the meat to create the nitrosamines.
Thank you for clarifying that. Someone is asking, does roasted garlic retain the healthful properties?
So garlic is very sensitive to heat, and I would say, and what activates the cancer-fighting compounds is crushing or chewing or cutting up that garlic. So if you're going to cook with it, the best thing to do would be to cut it or crush it and then let it sit for 10 minutes so that the compound is able to be released. And then when you expose it to heat, you lose less of that compound. So roasting it whole, I would generally say will probably kill most of the cancer fighting benefits. But some easy ways to have it raw would be to put it in a salad dressing or a guacamole or pesto or things like that. And then you can still eat roasted garlic if you like it, but then you would know for sure that you're getting more benefits if you're having it raw.
And then when you were talking about the mushrooms, do you think that the mushroom supplements that are out there on the market are just as effective as eating the fresh mushrooms or not quite?
So I would say they are actually more effective, and that's because you're just able to get a lot more of the mushroom in a dose of a supplement than if you were to eat mushrooms. But that also falls into the area of if you are going through treatment and wanting to take a mushroom supplement, just make sure to talk to your doctor.
Okay. And then sort of in the same vein, someone was asking if garlic supplements have the same benefit as fresh garlic. And then,
Um, oh, go ahead.
sorry, it's a two-part. And then also, does store-bought minced garlic or garlic powder have the same benefits? So sort of different forms of garlic.
Okay. So looking at garlic supplements, there have been some studies that have tried to identify how much of a garlic supplement is actually absorbed, and it varies widely. And there's a lot of different ways that you can take a garlic supplement, meaning there's the garlic capsules, there's like a powder and a pill and those kind of things. And so it varies. But from what I've gathered, it seems that aged garlic extract in a supplement seems to have the most benefit as far as being absorbed. And as for effectiveness, it's hard to say. It's hard to measure the benefits of taking a garlic supplement, but I do know that because it can help with blood pressure and cholesterol, there are people who have taken garlic supplements and they can report measurable improvements in their blood pressure and cholesterol after taking the supplement. And so for me, that would be one way to see that it's working. And then with minced garlic and garlic powder, the trial that I referenced said that 1.5 teaspoons of garlic a day seemed to be enough to activate the gene activations. It seemed to be referring to garlic powder. It didn't specify, unfortunately, but it seemed to be referring to garlic powder. So my guess is that it would still have some benefit. I always just like to try to get fresh garlic, raw garlic in my diet on a daily basis just to make sure, because it's hard to really say how beneficial the other forms are, but it definitely wouldn't hurt. And then minced garlic, I feel like personally, just because of how the processing and how long it's probably been sitting there, it's probably not as effective. But again, with the same with garlic powder, it's hard to say. It's garlic is such a healthy food that you can't really do wrong getting those in your diet, but try to maybe aim for some raw garlic somehow in some way.
Okay. And then there was a question about healthy fats or good fats that are commonly found in like a Mediterranean diet, like olive oil or avocado oil. And they were asking if they have any kind of cancer fighting benefits.
Um, Not necessarily cancer fighting, but they're good for your overall health and heart health. So those are avocado oil and olive oil, especially, are two very good fats to get in your diet. Avocado oil is good to cook with as well because it has a very high smoking point. So the point that it can heat before it starts to let off a lot of smoke and kind of change its structure. So they're still very good oils to include in your diet.
Okay. And then there was a question about milk products and whether milk is okay to drink, and then also eating organic versus non-organic.
Organic milk or just organic in general?
It does not specify.
Okay. So dairy is I it's not something that needs to be cut out, but it is best to be limited. Even if it's a hormone-free dairy in which no hormones have been added, it still has some natural hormones just as the result of being breast milk from a cow. And so limiting it, if possible, is a good idea. And you can always try plant milk. There's so many different options now, but it's not something that needs to be cut out entirely. But there have been some studies that have shown an increased risk of breast cancer with increased dairy consumption, with the exception being probiotic foods. So like yogurt, the benefits of the probiotics outweighs anything bad that would come from the dairy part of that.
I usually
And
tell people to clarify a little bit on that, Marin. Keep it under 2 servings a day. I don't know. A lot of people ask me, well, what does that mean to limit it? Um, and that would be cheese and yogurt and all of the dairy products.
yes, good point. Thank you, Marcy.
Yeah.
And then for organic, I don't know if the person that asked that, if you want to specify if you're talking about organic dairy or just organic food.
It was food.
Okay. So there are certain foods that if you can get them organic, it would be a good idea, because it's the pesticides soak into them more. And that's certain fruits and vegetables that have really soft skins and don't have a peel that you can just get rid of. So like berries, bell peppers, tomatoes, things like that. And then things that have a peel like bananas or avocados or pineapple, it would be less important. But you can always just wash your produce either with water and vinegar or baking soda to get some of the pesticide residue off. And the Environmental Working Group has a list of foods that they recommend that you try to get organic if you can. And so you can search for Environmental Working Group Dirty Dozen, and that will tell you which ones would be the worst in terms of pesticides.
And they update that list every year too.
Mm. So there was a question that came in around CBD and marijuana edibles and their relationship with cancer and or reoccurrence. Do either of you have any information on that?
Do you,
So
Marcy?
I haven't read research on that, to be totally honest. Yeah.
I haven't either, but I do sometimes recommend it to patients who are struggling with their appetite or have had a lot of weight loss or having nausea. Some people find it helpful and some don't. So it just is kind of up to the person, but it's not something that I've looked at as far as cancer itself.
Right. I've worked with a lot of folks too that have found some benefit and some don't as well, but not aware of any research.
Okay. And then there was another question that came in around vegetables. And is there one way that's better than another to eat them? Like steamed, stir-fried, roasted, are some ways better than others?
Do you want to answer it? Or would you?
Sure, I'll go for it.
Okay.
I usually tell people to mix that up. It depends on the vegetable. Like tomatoes, for example, are better cooked because of the lycopene is more bioavailable. We learned about garlic. So I usually tell people do fresh, frozen, cooked, raw. Avoiding canned is the most important. A lot of those water or heat sensitive nutrients are destroyed during the canning process. But I always stress frozen. Like frozen fruits and vegetables have a great nutritional value and it's great for off season and if you don't want to go to the grocery store constantly.
I think we kind of already touched on this with dairy, but there was just another question about dairy's relationship and the hormones in milk. Like, is it bad for a hormone-driven breast cancer specifically? But then also, like on the flip side, being protective of bones, which might be a concern for someone who's on an aromatase inhibitor. And how do you sort of balance that?
So actually studies have shown that the increased dairy consumption actually has results in greater rates of osteoporosis and bone breaking incidents. And the reason for that is because dairy is a food that creates more acidity in the body. And so the bones have to buffer out calcium in order to balance it out. And so I would always recommend getting calcium from plant sources if your concern is osteoporosis. And that can be found in like leafy greens, tofu, and that's something we can also send out is plant sources of calcium as well. And then the other question, we kind of already addressed it.
Mhm. Wonderful. Let's see. The next one is, are there any recommended sources of protein for those that are told by a doctor to eat a lot of protein?
So this would be another individual question. I would say if you're vegetarian, you can certainly do nuts and seeds. You can do tofu, or even if you're vegan, you could do tofu. You can do legumes are all good sources. Back to the protein powders. I know I had a question on creatine. Creatine is not a protein powder that I usually generally work with or recommend. I do believe it's safe up to a certain quantity, but protein powders are a nice place to get protein as well. I'll usually suggest either whey if you do dairy, or you could do a pea or a hemp protein during treatment. But then, of course, if you're vegetarian, you could do add in those dairy products. And then if you're pescatarian, you can add in the fish products. And then if you just have a general diet, then you know, adding in poultry and then small amounts of red meat, uncured red meat, I think is fine too. So they can be plant-based or animal-based sources of protein, or they can be through supplements as well.
And then there was a question about eating pickled garlic and whether or not the pickling process is problematic at all.
No, it's not.
Okay. And then a specific question about fire. Let's see. In a wood-fired oven, that like super high temperature, does that have any kind of negative impact on cooking or grilling vegetables at a super high temperature?
It only would if, like Marcy said, certain vegetables actually develop more antioxidants when they're cooked. So, as far as I know, there's no issue with cooking vegetables at a high temperature. Um, the only exception being there are certain compounds that form when potatoes are cooked at high temperatures, and it also happens when coffee is roasted, that can form carcinogens, but they're insignificant compared to the other carcinogens that you could come across on a daily basis. And so it's not something that I would be overly worried about.
Okay, and the last question that I see in the chat right now is around pine oil. And if you guys are familiar with it at all, and they're citing, it looks like they're citing a research study that was done talking about how pine needle oil possesses anti-cancer effects. Are you guys familiar with that at all?
No.
I have not worked with pine oil.
Okay.
But
All
that's
right.
something that I'll look into to see if there's any studies on that. I'd be kind of curious to know.
Okay. And actually, one more just came in around coffee. And should that be avoided for any reason?
So I usually tell people up to 16 ounces a day is safe and actually counts towards our fluid intake. After that, it counts as a diuretic and we start to lose fluid. So just real practicing moderation with coffee. And as Maren pointed out, when you compare the high heat that, with the potatoes and the coffee in relationship to other carcinogens we come into on a regular basis, it's insignificant, not something to worry about. So up to 16 ounces a day
And there
is
actually
safe.
have been health benefits associated with coffee intake. So yeah, like Marcy said, I usually just advise people, especially if you're going through chemo, to be aware of the dehydrating aspect. But other than that, there's no reason.
Okay, I think that's the end of all the questions in the chat. Thank you both so much. That was a huge amount of information, and we so appreciate all your knowledge. I would love to have those handouts you guys mentioned, and I'd be happy to send those out to people. And there's also going to be a follow-up survey for feedback that we'd love for you to fill out. It just appeared in the chat there. If you could do that for us, we'd really appreciate it. And I'll also send the link for that out as a follow-up too. And this recording should be available sometime within the next couple weeks. So thank you all so much for joining. And thank you so much to Maren and Marcy for being here and giving us so much food for thought.